This is the lecture for week 7, and we'll cover phenomenological and humanistic existential psychotherapies. We're going to cover a range of therapies and perspectives in this section that broadly fall under the phenomenological and humanistic existential therapies, but it includes client-centered therapy, which is also like a phenomenological perspective, and the prevailing therapy within client-centered therapy is like a Rogerian therapy, this Rogerian movement. We'll also cover humanistic existential movement, which consists of humanism, existential therapy, logotherapy, and Gestalt therapy, or a Gestalt perspective. And then finally, we'll cover emotion-focused therapy. So starting with client-centered therapy, one of the sort of founders or first thinkers within this movement was Otto Rank, who was an Austrian psychoanalyst, worked with Freud. And kind of unlike Freud, rather unlike Freud, Otto Rank allowed patients to exert their will in therapy. They had a say in the therapeutic process, and he believed that the therapist should not dominate the patient or tell the patient what to do. Similarly, Jessie Taft was a social worker who was heavily influenced by Rank and brought these ideas and further developed them when she brought them to the United States. She thought a lot about relationships and regarded the relationship between the patient and the therapist as one of the most important factors in therapy. And in the modern age of clinical research, we know that this is true, that rapport, or this relationship between the patient and the therapist, is one of the most important factors in therapy. So she kind of intuited this before we had that research to back it up. And then we have Carl Rogers, who is the face of client-centered therapy. He was trained in psychoanalytic therapy but didn't really fit in. He was influenced a lot by Rank and Taft's ideas, and came up with this new therapy or new perspective where the emphasis was on human relationships and real human relationships that were consistent with his religious beliefs, as well as his democratic convictions. So the idea that no one person should dictate the life of another individual, at least not wholly. And it was based on his own encounters with clients and noticing that clients had a lot to bring to the table, that the therapist is not all-knowing or all-powerful, and that the client's will and the client's perspective is extremely important in therapy. So all of these observations and ideals helped Rogers shape what he called at the time non-directive counseling. And non-directive counseling emphasizes the importance of a client's perception of themselves. It recognizes that there's something inherent about humans where they want to develop their own capacities or improve their self, and this was called self-actualization. So the idea that individuals are always moving toward this ideal version of themselves. And non-directive counseling, importantly, facilitates an individual's growth potential. So it recognizes not just the negative sides and the problems with a person, but also their potential and their strengths that could be tapped into to help them develop and improve any situations that are not ideal in their lives. So Roger later replaced the term non-directive therapy with client-centered therapy. And it was later considered, not so much during Rogers' main period of productivity, but later considered to be under the umbrella of like humanistic orientations. Humanistic meaning that individuals are viewed as human, not just coming in as a diagnosis or a set of problems, but a whole unified person who's unique and has their own set of experiences, who is treated with respect, exercises free choice, and is supported in striving to develop their own inner potentials. Client-centered therapy is anchored in a broader field of phenomenological theory. Phenomenology is mostly a philosophical term. So there were a lot of like phenomenologists who are philosophers that were interested in different ways that humans experience the world and how people's often faulty or inaccurate experiences of the world kind of affected how they would think. And so in the context of therapy, in the context of Rogers' client-centered therapy, phenomenology was the idea that an individual's behavior is completely determined by their, what he called like phenomenal field, which is essentially their field of experience. So everything that a person experiences is, a person is made of what they experience at any given point in time. And the phenomenal self that he referred to is this sense of like I-ness or me-ness, this kind of subjective sense of self that people experience. One of the fundamental ideas of client-centered therapy is that self-esteem is the foundation of behavior, meaning that people are driven to maintain a certain image of themselves. So as you're reading this chapter and throughout this lecture, a lot of the terminology might be a bit confusing because it might be terms you know that are used in a different way, especially with Rogers. So he based a lot of his theories on philosophical traditions and philosophical terminology. And self-esteem in this sense is not is kind of similar to how we use it today, but it more means how somebody views themselves in general. And the idea was that when somebody's self-esteem or somebody's self-view is threatened, so for example, they get information that their self-view may be inaccurate, that's when problems can arise, psychological problems can arise. So following an experience, a person might react in one of three ways. They might integrate that experience into their idea of themselves. They might ignore it because they consider it irrelevant to themselves, or they may kind of deny or have a distorted interpretation of the experience because it's inconsistent with how they see themselves. So for example, this reminds me of a client of mine who was I'll kind of make up some of the details in order to maintain confidentiality, but this client was a really good tennis player and he thought that he was going to play tennis professionally. And it turned out that he didn't, but that was from some things later in life. But there's an incident that happened when he was in college and playing tennis in college where he had a bad game, and he'd never had a bad game in his entire life. He'd never played poorly during a competition. And so there were kind of three ways that he could have integrated that experience into his self-image or his self-esteem. Three ways he could have reacted to that. One, he could have integrated this into his idea of himself. So previously, his idea of himself had been, I'm a great tennis player that never makes any mistakes. And so he might have changed that idea slightly to, I'm a great tennis player and once in a while I have a bad game. Or he could have ignored it because it's irrelevant to him, so he could have just kind of ignored it and pretended it didn't happen and still considered himself to be a good tennis player. Said, well, that just wasn't me. I wasn't me on that day that I had this bad game. Or he could have sort of denied or distorted it because it was inconsistent with the self-image. So he might have said, well, it wasn't me that had a bad game, it was the judging was unfair, or I was penalized unfairly. So he could have had a distorted idea of that experience that was where he was able to maintain that self-image. Rogers believed that people who were really well-adjusted could integrate all experience that they had into their self-concept, into their phenomenal field. And he thought that it was the goal of the therapist to help people become well-adjusted by facilitating this integration, so that there weren't all these threats to the self constantly perceived. You could see how somebody who was sort of rigid and was always rejecting, who had a rigid idea of themselves and wasn't able to kind of adjust that idea and respond to new experiences and new aspects of themselves, you could see how that could be problematic in daily life. And so Rogers felt like this flexibility should be increased. Someone who was well-adjusted would be able to kind of change the self-image based on the circumstances. And this was in part his rationale for an atmosphere, for the atmosphere in client-centered therapy, which was an atmosphere of warmth and acceptance and permittance, permittance of fault and permittance of self-doubt. The idea was that in the therapy setting, there shouldn't be any threats to the self-concept or self-esteem, so that people were sort of felt comfortable enough, let down their guards, and were more able to integrate new experiences into their self. So the core features of client-centered therapy are empathy, unconditional positive regard, congruence, and then a focus on attitude versus technique. And we'll go through each of these individually. Empathy was a huge aspect of Rogerian therapy, and it's an aspect that a lot of people who don't practice client-centered therapy or don't explicitly practice pure client-centered therapy, a lot of therapists will still take this aspect of client-centered therapy and apply it to in therapeutic settings. So empathy is, as we've discussed before, it's conveying a sense of understanding to the client, having sensitivity to their needs, their feelings, and the circumstances of their life. Empathy should be genuine. There's nothing worse than ungenuine empathy, and people see right through it. It should come from a deep, genuine regard for the client. And through empathy, the client will realize that the therapist is working hard to understand them, which is extremely important in general for clients. They want to know that the therapist genuinely cares about understanding their unique circumstances. And Rogers believed that this was the basis, the bottom of the pyramid for a therapeutic relationship. Unconditional positive regard is also another huge aspect of client-centered therapy, and this is what a lot of people associate with Carl Rogers because it's kind of extreme. And the idea is that you have a complete lack of judgment toward the person, ultimate respect for the client as a human being, and it's not contingent on how that client reacts or the things the client says or does. So even the person that might be the hardest to regard positively, somebody comes in your office and like some of the people I've worked with have killed people and have done some really horrible things to other people, but the idea is that you would still find it within yourself to respect them and not judge them, especially when it's some of their actions may be inconsistent with your values. It's especially important to kind of work on that and find a respect for them beyond that. Part of unconditional positive regard is also a genuine acceptance and caring and a belief in the client's ability to change and to do well. And the idea is that this reduces threat to the client, that if a client feels that they're being completely unjudged and feels that they're being held in high regard, they're more able to give up their defenses and grow as a person. And this is something I strongly believe in. I think there's a huge power in unconditional positive regard. A lot of people that come into a therapeutic setting, at least in the populations I work with, which tend to be lower income and people who suffer from a lot of systematic disadvantages and who may not have a lot of people in their lives people or systems in their lives that boost them up as a person. They have a lot of things beating them down and dragging them down and telling them they can't every day. And I think it can be incredibly powerful for someone to come into a therapist's office and that person to just see the good in them, regardless of what that person has done. So unconditional positive regard, I think, can be an extremely powerful thing. Congruence is another important aspect of client-centered therapy, and this is just a weird term for essentially like open honesty within the relationship. So in a lot of therapeutic settings, in most therapeutic settings, the therapist is to sort of project or is to sort of like hide their feelings about a lot of things, project calm. If something the client says makes you irritated or angry, you're not supposed to really show that. But in contrast, in client-centered therapy, the therapist is supposed to express their feelings and behaviors that come from what the client says. Carl Rogers believed that clients respond favorably to this. They see it as genuine. They see you as a human in this situation, and that this is this adds to the good rapport between the client and the therapist. And then finally, in client-centered therapy, there is an emphasis on attitude versus techniques. So the idea is that it's a state of mind and not like a set of tools or techniques that are used. It's some of the important aspects of the client-centered attitude is that it's non-directive. So you try to avoid procedures and avoid implications that the therapist is the expert. And the idea is more to facilitate the individual in discovering things about themselves. So sort of the truth lies within the client, and you're there to help them uncover it. The truth to how they're going to be self-actualized. Self-fulfillment and health are emphasized over the destructive nature of a client. And then the inner experience is the most important data, meaning whatever the client experiences or feels or thinks is more important than what might actually be true or what might actually be present in the outside world. So there's kind of a primacy or utmost importance on how the client sees the world and how the client and the client's own beliefs. Diagnosis is highly de-emphasized in client-centered therapy. It's considered in some ways detrimental. It's kind of an authoritative way of labeling a person. It impedes the client's sort of autonomy, their own ability to describe themselves as an individual or see themselves as an individual and be self-actualized. And in client-centered therapy, the focus should be on the feelings themselves and not whether these feelings are so-called correct. Some features of client-centered therapy. So sessions occur about once a week, which would be typical of a lot of modern therapy modalities. Client-centered therapy includes, as we've kind of discussed, acceptance of the client, recognition of their feelings, helping with clarification of feelings, rephrasings, and reflections. So lots and lots of reflections. A lot of a client says something and you just sort of repeat their words back to them, which sounds basic. It sounds like it's wouldn't be that helpful, but it can be actually incredibly helpful. And we'll cover that a little bit later. I'm going to talk about motivational interviewing later. We'll kind of talk about how important just having someone else say your own words back to you can be. Client-centered therapy does not include information giving, advice, a lot of reassurance or trying to persuade somebody to act or think in a certain way, and not much questioning or interpretation of an individual's experiences or words. Some positive things about client-centered therapy: focusing on the past is not necessary for change, which is nice. You don't have to dig through somebody's entire history. You can just kind of focus on what's going on in the here and now. It emphasizes an individual as being directed, self-directed, self-determined, and this is emphasized over biological urges and instincts like psychodynamic therapy. The use of the word client, which is used intermittently in modern healthcare, but there's definitely a push to use the word client as opposed to patient in modern healthcare, and this is kind of where it started, the idea being like somebody isn't sick, they're not a patient in a hospital, they're a client, they're coming to you for your services. Clients have freedom of choice within client-centered therapy, and there's an equal standing between the client and the therapist. Client-centered therapy also requires shorter durations of treatment compared to psychoanalytic or psychodynamic therapy. Less time is needed to train therapists, so therapists don't need to be PhD level. They can receive relatively less training, in part due to the emphasis on the general attitude and philosophy. that the therapist comes into the session with compared with as opposed to therapists having a set of techniques that they have to hone. And there is an emphasis on research since the beginning of client-centered therapy, including methods and outcomes. Client-centered therapy is shown to be moderately efficacious. It's not necessarily any more effective than other psychological treatments. And the active ingredients or most important components seem to be the strong therapeutic alliance, empathy, the expression of positive regard. These appear to be most important for positive outcomes, as they are in most therapies. There are certainly limitations to client-centered therapy as well. A large limitation to client-centered therapy is that therapists can't affect change. So you're not necessarily giving the client any tools. They don't get anything extra other than what they came in with. Their inner potential is released, and it's really strengths-based and encourages people to use what they already know, but in some cases it seems that clients can also use some tools and additional information that can be helpful in a therapy session, and client-centered therapy doesn't provide that. Some people have criticized it for being too intuitive, that there aren't clear techniques and clear methods that can be used and taught, that a therapist is to just kind of intuit what the client needs. There's certainly, kind of related to that, an influence of the therapist's personal framework, how they see the world. So therapy, the personality characteristics of the therapist enter the office a lot. There's lack of superiority over other methods. As well, there are a lot of kind of vague and idiosyncratic and rather like philosophical and abstract concepts. A lot of the concepts promoted by client-centered therapy imply that other therapies don't do these things, which I think is not true. I think many aspects of client-centered therapy are also found in other therapy modalities. Effectiveness of client-centered therapy is almost certainly less for people who are less verbal, who have more severe psychopathology, and people with fewer cognitive resources, so lower IQs. Client-centered therapy, I think, might be best for people like educated, who are young, who are minimally distressed and kind of just need some help and direction in their life. Which I think is mostly college students or other educated, highly educated young individuals, which is indeed where client-centered therapy was developed with college students. So it would make sense that it's most effective for these individuals. Here are some videos. There's a lot of nice videos on YouTube of Carl Rogers doing therapy, individual therapy, group therapy, and also just kind of talking about client-centered therapy, and they're really nice. He's a great speaker. Okay, so the humanistic existential movement was based primarily, or in the beginning, on kind of humanistic psychology more broadly, which views individuals as whole beings that are where all the characteristics of a human is unified and related to each other, and views individuals as unique beings who have a right and who should exercise free choice in their lives and strive to develop their full potential. And humanistic psychology historically was a reaction to the deterministic views of science at that time. One informant of humanistic psychology was Maslow. You might be familiar with Maslow's pyramid, and I won't go into explaining it because this wasn't in the textbook content, and I don't want to add more material right now, but the essential idea of Maslow's pyramid is that, or hierarchy of needs, is that basic needs must be met in order for psychological needs to be met, and psychological needs should be met in order for self-fulfillment, or someone to achieve their full potential. Existential psychology is based off of existential philosophy, so you might be, if you have any philosophical background, you might be familiar with Kierkegaard, Heidegger, Sartre, etc. These philosophers are mostly interested in how people search for meaning and how people find meaning in life. And so existential psychology is likewise interested in how humans engage in a search for meaning. Philosophically, existential psychology is very similar to phenomenology, very similar to a lot of the basic philosophical tenets that Carl Rogers used in his therapy. Existential psychology also emphasizes that people function within a social context. They make decisions based on both facts and the imagined possibilities for the future. And one important component or theory within existential psychology is that people can either choose the present or the future, and choosing the present leads to guilt and regret for the missed opportunities. So kind of maintaining the status quo and doing things as they've always done will lead people to regret not having tried to be better, tried to do more, tried to live a more meaningful life. On the flip side, choosing the future, choosing to change and strive for more, comes with anxiety about a lack of knowledge and control over the future, knowledge or what is unknown, what is ahead. And in order for people to choose the future, which existential psychologists would want people to do, they must be confident in themselves and trust themselves to be able to handle the unknown. So in existential therapy, the goals are to build self-awareness, accept responsibility for one's decisions, tolerate that anxiety of the future, and accept things that cannot be changed. Techniques are de-emphasized in this therapy as well, and therapy is considered sort of an encounter that helps the client come closer to fully experiencing themselves and finding and attaching meaning to their life. The therapist will confront's a strong word. The therapist will provide clients with questions that force them to examine the reasons for whatever isn't working in their life, or whatever it is about their life that is devoid of meaning, and to try to fix this and search for what is meaningful to the individual client. Logotherapy is a type of existential therapy, and it means literally the therapy of meaning. And so Viktor Frankl was the man behind this. He was a Jewish psychologist who was placed in concentration camps during the Holocaust, and he lost many important people, lost his family and his wife and friends. And he has this incredible book that some of you might have read. A lot of high school reading lists include this book. It's Man's Search for Meaning. It's a short book. If you're interested in existential therapy or existential perspective, I highly recommend it. And Frankl observed while he was in the concentration camps that people who found personal meaning to their existence were more able to survive. So he based a lot of his tenets of logotherapy on this experience throughout the Holocaust. And here's a video of Frankl where he entitled Why I Believe in Others. He's not specifically talking about therapy so much, more talking about kind of some of his ideas. It's a short video. Logotherapy was meant as a complement to traditional psychotherapy, so not as a therapy modality in itself. And in logotherapy, Frankl emphasizes establishing meaning in the present and having kind of a goal-oriented outlook for the future, creating a sense of choice in an individual's life. There are two main techniques in logotherapy. One is paradoxical intention, which, if you are familiar with exposure therapy, we touched on this kind of lightly in a previous session, and we'll touch on it more in the CBT section. But it's paradoxical intention is a little bit like exposure, where a client attempts to perform the behavior or the response that they fear, that's the object of anxiety and concern to them. So, for example, if somebody's afraid of blushing during public speaking, it's suggested that they try to blush the next time they speak publicly, and Frankl observed that often the result is that they're unable to blush. So it's kind of like facing the monster under the bed and realizing it's not there a bit, or by facing the monster under the bed, the monster disappears. Deep reflection is another technique, and this is when the therapist instructs the client to just ignore a troublesome behavior or symptom and try to focus on more constructive activities. Gestalt therapy is another subsection of humanistic existential movement and is most closely affiliated with this German psychiatrist named Fritz Perls, who moved to South Africa during the war. Perls emphasized the importance of the present experience rather than focusing on the past or thinking about the future. He was focused on awareness of emotions and behaviors in the immediate present, and believed that this was important for an emotional connection with the self. And Gestalt therapy in general has had different champions at different times, and a lot of different people have had different interpretations and different versions of Gestalt therapy, so it's a rather heterogeneous mix of techniques and ideas. But in general, it's still this emphasis on the present time, an emphasis on connecting with the self in the present. So one technique that Perls would use was to constantly call a client's attention to how they're feeling presently, what their thoughts are, what their feelings are, and what they're experiencing. And in this, a client might repeat, "Now I am aware," and then talk about what they're aware of, or the therapist might repeatedly kind of prompt the client to report what they're aware of. In Gestalt therapy, it's important that a therapist pays close attention to nonverbal behavior, as this can be an indication of what the client's experiencing. There are aspects, dreams are important, so Perls was trained in psychoanalytic theory, and there's certainly a lot of threads of psychoanalytic theory within Gestalt, and within Perls' version of Gestalt. So reliving or acting out dreams within the therapy room is a component of Perls' version of Gestalt therapy. There's also, he has a theory of top dog and underdog. Top dog is roughly something like superego, like what a person thinks they should do, and then underdog is like the id, or what a person instinctively wants to do. And Perls would encourage people to sort of play the top dog and the underdog and create a sort of explicit dialogue between those two, with the goal of sort of integrating what a person feels like they should do and what they want to do at a more base instinctual level. In Gestalt therapy, the client is forced to become aware of any defenses that they might use to hide their authentic self. Accepting responsibility for their actions and feelings is a huge part of Gestalt therapy. There's some kind of games that have been developed to play out Gestalt therapy. So games in like a therapeutic sense that may not be fun, more like techniques, I suppose. So for example, adding and to take responsibility for that whenever somebody describes an aspect of themselves or something they've done. Role-playing, and a technique in which a client repeats an important phrase over and over again, each time becoming louder to kind of emphasize that important phrase to themselves. There are rules of Gestalt therapy, general rules. One is that communication is always in the present tense. Communication is between equals. The client and the therapist are equals. Client uses I language, not it language, in order to take responsibility for their feelings and thoughts and actions. There's again a continual focus on that immediate experience. There's no what they call gossip, or like talking about other people, so you're not coming in and talking about all these things that your mother did. You're talking about yourself and your experience, and questions are discouraged. Some moral precepts or rules for the client to live by outside of the therapy session is to live in the present, to live with what is present and not focus on what's absent from their lives, to experience what is real and not sort of imagine all these things that could be, stopping unnecessary thinking, so not ruminating about everything, not trying to kind of live in the now. Direct expression, so not judging or explaining or manipulating information. Being aware of both the pleasant and the unpleasant. Rejecting the idea of what a person should do or ought to do, and taking complete responsibility for actions, thoughts, and feelings, in this way surrendering to who someone really is. So it's kind of a version of self-actualization by being super grounded in the present and super grounded in what appears to be reality. If anybody, we'll talk about mindfulness therapy or mindfulness meditation and mindfulness as a component of dialectical behavioral therapy. And some people, you might draw some parallels between this if you're already familiar with mindfulness. A lot of sort of like living in the now and non-judgmental thinking about oneself and sort of accepting, radical acceptance of reality. And here's a video, a couple videos of Fritz Perls talking about Gestalt therapy or engaging in Gestalt therapy. The first, well, both of them are kind of ridiculous. He's sort of a ridiculous person, but brilliant but ridiculous. So I recommend watching these videos, even if you don't watch the whole thing, just to get a kind of a sense of the cultural context in which this therapy emerged. Okay, and finally we have emotion-focused therapy, which is kind of a more modern therapy that is based on a lot of Gestalt principles. It was developed by Leslie Greenberg and Sue Johnson, and it integrates Gestalt and client-centered therapy. In emotion-focused therapy, emotions are considered adaptive. They give life meaning and value and direction. So emotional regulation is important for personal growth. And dysfunction of emotion, or dysfunction is the result of the impaired ability to integrate new experiences into a coherent self. So that kind of is a throwback to Carl Rogers. Dysfunction can also be the result of an ability to identify and experience emotions and also regulate emotions. And in EFT, the therapist provides a supportive environment so that the client can explore and transform their emotional states. They can kind of realize their emotions and realize ways to control those emotions or change those emotions. And this modality does have research supporting efficacy.